This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222. The long-term side effects, 0. Again, as I said many times, IVF patients have been followed up through now nearly 40 or over 40 years, looking for potential long-term side effects. The ones we particularly we used to be concerned about related to the fact that we overstimulate the ovaries, and may that have a long-term effect on the health of ovaries. It does not. Huge studies particularly out of Scandinavia, where they link all their data together, have shown no increase in ovarian cancer, which was our biggest concern. It doesn't reduce your time to menopause. Although we are we are harvesting 12 eggs a month, say, instead of 1, then we're not actually depleting the overall store of eggs, because every month a woman loses around 100 to 200 of her eggs anyway. That's the way nature works. Women start with life at birth with 500,000 eggs, and they end up at 50 with none at menopause. Now, all that is saying is that each month women are losing hundreds of eggs, and what we do with IVF is actually saving some of the eggs that otherwise would have been lost. So it doesn't bring the menopause earlier. In terms of the acute impact of an IVF cycle, you start using injections in your tummy. We hope that you'll produce lots of eggs, and that swelling of the ovaries is unusual for them. And so most women feel a degree of discomfort if they're stimulating well in their lower tummy. Not pain, more like bloating is the feeling that most patients notice. You also will potentially have a slight increase in weight, which goes away once you've either had a period or carries on if you're pregnant. But that's fluid retention that goes along with the hormone changes that go with the cycle. The egg collection has risks like any procedure. We're sticking a needle through your vaginal wall, sticking it into the ovary under ultrasound vision. There are complications that can occur where a needle goes through a blood vessel that is not visible, and you can have some internal bleeding. About 1 in 1,000 patients end up in hospital with that bleeding, but it's a very low chance. We're also going through the vagina, which has a bacteria within it, and we were worried that we would introduce those bacteria into the ovary and cause infection. Again, risk 1 in 1,000. More likely in women who've got endometriosis or endometriomas, those cysts in the ovaries. Then after egg collection, the one big concern we used to have, and we still have the concern about it, but the incidence has dropped substantially, is something called ovarian hyperstimulation syndrome. This occurs when there have been lots of eggs collected and the hormone estrogen levels have been very high. And what happens is that the blood vessels generally in the body become leaky. They leak fluid into your tummy. Fluid collects in your tummy and sometimes even in your lungs to make breathing more difficult, but also in the tummy, causing substantial swelling of your tummy. It can shut down the kidneys, and I've seen a woman with kidney failure after ovarian hyperstimulation. It was short-lived, but it did occur. Stopping passing urine is another sign that the situation is bad. And lastly, but very rarely, strokes can occur with hyperstimulation syndrome. Around the world in the 90s and early 2000s, there was reported probably 2 or 3 women dying with hyperstimulation syndrome after IVF. Today, it's almost 0. And that's because we understand more about why it happens, and we use different treatments to avoid getting hyperstimulation syndrome. I'm not going to spend a lot of time discussing that change, but the change is there, and in clinics that are using modern approaches to IVF, it is incredibly rare to get ovarian hyperstimulation syndrome. There are still some clinics and doctors who use old-fashioned regimes, and those patients are at higher risk. It's exposure to the compound HCG, and in that situation that causes the problem. And giving HCG injections, these days called Ovidril, in the second half of the cycle when you've already had high levels of estrogen is very dangerous and should not be done. And then side effects. Obviously, the mental pain that you go through should, after all of this, you not get a pregnancy is obviously a significant thing to deal with. But again, in the right clinics, with the right support around you, we can get you through that and pick you up and move forward, potentially to another cycle and ultimately a pregnancy.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey Podcast from the navigation menu.